Well, this is called a yoga block or an Iyengar block. He's the one that started introducing it. And I like to wear it right there. And I like to do some practices here. I even do the inhale as if you're holding a pencil between your shoulder blades. Oops, it's a little crooked. There we go. And exhale. And this is fun for you to do with your kids. And with a book. I had a dear common friend of ours who had meditation groups at her home, and she was in her 90s here locally that we both knew. I had her walking around her house with this on her head because she was in her 90s. She was very stooped over.
Yeah.
But you start these habits with childhood. There you go. So
I
just
like that it's light.
yeah, it's light and it's fun and it's just it's playful.
Well, what you're doing, I mean, even for me, just putting it on for a second here, it completely and immediately makes me aware that I'm in a body. For one thing, when you're immersed with what's going on in the world on your screen, and you're lost in whatever somebody just tweeted or what they posted or the picture that they shared and the comments, and you kind of leave your body, right?
Yeah,
And
exactly.
this is such a great way to kind of come out, oh.
Here's another one that I love. Bring your thumbs to your sternum, to the chest wall, and see if you can feel the thumping of your heartbeat, especially if you have any anxiety. You might feel thumping in your heart, of your heart in your chest. And then observe how many heartbeats for your inhales.
And
And
just
how
try
many,
this with us.
try it with us, and how many heartbeats for your exhales.
I'm feeling it more in my thumbs, the pulse. Is that okay?
That's fine, yeah. So basically it's a very primitive way of taking your own the quality of your heart rate. It's not as scientific as having an Apple Watch, but you're checking in with yourself. You may feel it more here, but just to check in with yourself and observe and maybe close your eyes for a moment, and then check in also with your breath. Like as you're feeling your thumping of your heart, like the rhythm section, think about the breath being the flute, the melody, the recorder, the right. So see if you can count how many heartbeats for your exhale without changing the length of your exhale, and how many heartbeats for your inhale. So when a child is in school and somebody is bullying them, or a teacher is talking and becoming a little, something is agitating, the child can just sit there like this and nobody will even know. And they can just say, am I breathing? Is my heart racing? And then grounding. The most grounding practice is to feel the feeling of your feet in your shoes, and your shoes resting on the earth.
Nice.
It's grounding, feeling the weight of the limbs resting on the chair. It's grounding, feeling the pelvic bowl just resting on whatever object you're sitting on.
You know, one thing I'm thinking about, because our kids get hyper aroused certainly when they're playing a video game, the level of stimulation, but also just if they're engaged in social media and there's a lot of drama, there's a lot of intensity, maybe some anxiety, some fear, some worry. This is such a simple way to say, how are you doing? Like, check in with your body, because we are not just our mind or our emotions. We also have this body, and the body will bring us into a more regulated state. So if you could start teaching your children this simple way of doing this, or as you showed us, putting the hands here and feeling your heart, and starting to become more aware that there are options, so that instead of cycling through that, like having it ramp up more and more, the intensity, the stimulation, the agitation, the anxiety, to just, okay, you can learn to do something to counteract that, to sort of step off that track.
And if I tell a child to do it, the child may have a defense against it and not want to do it and not want to be seen. doing what I told them to do because it's so complex.
Yeah.
This multi-track player going on in the child-parent relationship. So what I do is I just do it. And then both my grown kids are serious yogis, you know, and they and I never told them to do it. They would just come to my classes when I would teach it at Exhale, and they'd fall asleep in Shavasana. And there's my kid back there, fast asleep, heard my voice, passed out. But, you know, they grew up with it.
Nice.
There's another one. So we have Anjali Mudra where we consider holding spirit between our palms. So we hold spirit between our palms. We feel the thumping of the heartbeat through the chest wall. And then there's a tiny little neck flexion down. And then inhale, if your neck is healthy, you can look all the way up, stretch, stretch, stretch. Interlace your fingers, turn your palms inside out. You're holding the inhale. And then bring your palms behind the cerebellum, the base of the skull, and make that double chin. You know, pull the chin in. Holding the air out, pulling the muscles of the pelvic floor up. So you're holding the exhale. Inhale up. And exhale, come back to heart center. So it would look like this without me talking. And do that 2 or 3 times if you feel the impulse to do something that you want to stop doing.
Nice.
And that's going to work this whole area here
Nice.
where, you know, the shoulder neck connection. Then another thing is easy with your fingertips here, making circles. I like people to do this every day. Here, we'll coordinate. Inhale and exhale, and inhale and exhale. Getting the synovial fluid to lubricate the shoulder joint. Now, of course, there are counterindications in the other direction. There are counterindications to everything. If you have a rotator cuff injury, if you have any cervical spine problems, you don't want to do things that have counterindications, which is why yoga therapists do 1,000-hour training. You know, so that if they're giving a posture or a sequence that's very good to reduce anxiety or to you know, to manage depressed feelings, but the student, client, patient has a torn meniscus or a herniated disc, then the yoga therapist is trained to take all that into account.
Awesome.
If somebody has high blood pressure, yeah.
Okay, so I love that it's so comprehensive. So there's one other one that I've done for years for my eyes when I get into the stare. It's called the stare, where you're locked on visually to the screen for hours and hours and hours, and you don't blink.
Oh.
And so the stare really creates eye strain. So one of the ones I learned years ago, it's just called the long swing. And as you pointed out, Julie, there might be situations where you don't want to do this. But you're basically, I think I want to explain it first. So there's just the comfort of that. But what's going on with your eyes is what's important. As you're moving, as Julie's moving, you don't grab or fixate on any one point. So let your eyes just take everything in without trying to frame, rug, window. Just let it kind of come into your eyes. And what we'll be looking for is shifts. Eventually, right now you're fixating on me, you're seeing me. But as you do this for a couple of minutes, it all becomes just this relaxed blur, but your eyes will shift hundreds and hundreds of times between here and there. So the shift is a very relaxing exercise, and it relaxes the eyes, especially once you know that you feel that strain, maybe a headache coming on. You can do the long swing, and then you can do the palming.
Beautiful.
So any thoughts about that long swing?
Yeah, with the long swing, I would say the counterindications would be scoliosis, pregnancy, herniated disc. In those situations, we don't want to twist.
Yeah.
And because, well, with scoliosis, it needs to be a very, very mindful twist with a particular, because you have a concave side and a convex side. Okay. So you don't want to twist into the collapsed part of the discs. So, but this kind of easy from Qigong, actually, I always lead it with the hip, and it actually starts in the feet. you know, you can feel a,
Yeah.
a rebound in the feet. So
And I noticed
Be
that I
aware
just
of your
start
knees.
blinking, like just start blinking excessively, like just blink. And if, at first it's sort of a forced thing where you're blinking a lot, but it's breaking the stare. And if you let yourself really start blinking, then your eyes will just relax and they'll blink naturally, and there won't be any fixation on any one point. And that's when you know you're breaking up the kind of the frozen place that your eyes have gotten into when
Yeah.
they're like this for hours.
I'm putting this block on my sacrum to make sure that my hips are not lower on one side, and also to maintain a stability.
Yeah.
So I'm going to take this block and I'm going to put it on my sacrum to keep it stable while I bring one arm forward and the other leg back. So it's the left leg, right arm. And this creates a lot of strength in the whole spine, all along the spine,
Okay, good.
but especially the posture muscles for the upper back.
Which are the ones that we're kind of concerned about because kids are hunched over so much.
Right, exactly. So I've
Great.
got a block there. You can put anything there, just so that it doesn't fall. And now I'm going to bring my left leg back and my right arm, and just breathe here. And if you do it, they'll think it's fun.
Nice.
And I place my wrist under my shoulder, and I switch sides. Whoops. Yep.
So again, we're strengthening the muscles that might be becoming slouched or weakened by this kind of position that our kids are spending hours and hours in. That's great, Julie.
And breathe.
And these are things that your kids, you know, we want to get them off their devices, but this is something you can get them off their devices to do with you. You can have some fun with it, you know, not telling them to do it, but modeling it. In fact, you could just do it yourself and they might come along and say, what weird thing are you doing? Right? That's great, thank you. You do it a few times, I see. And is there a pose just that's relaxing? Is there something that kind of...
Child's pose. You can put your forehead on this, or you can put your forehead on the floor. You can put your knees wide.
I love that.
And if your legs are like this, you can inhale. This is a back bend. Exhale. Inhale. And puppy dog, which is like this. And child's pose.
How about it, everybody? We have all these ways.
Once in a while, I'd like you to try reading, take your book, and just be in this position. If it's comfortable for you, and if it doesn't bother your back, most children would find this very comfortable. And what you're doing here is a counter pose. Rather than being in lumbar flexion, hunched forward to read, you're reading like this. And you can read 5-6 pages like this. You can be on your laptop like this. You can watch a show. You can, whatever you want to do, but try some tummy time. And it comes from the yogic position, which is called, this is Sphinx. And during Sphinx, sometimes we stick the tongue out for lion's breath. And it looks like this. The exhale, the belly pulls to the spine. And then you can rest your forehead on the backs of your hands. And just daydream. But this tummy time leads you into, you know, I wouldn't have a child push all the way up. Some people push up too harsh and too high. I want you to strengthen your back, hold the pencil between your shoulder blades, and just let your hands rest on the ground and lengthen your neck. And breathe. And then when you press yourself up, you're in all fours and relaxed.
All right, let's just sum everything up, shall we?
Yeah.